A Halifax-based clinical psychologist is calling for a comprehensive prevention strategy on Nova Scotia's rising suicide rate. Dr. Simon Sherry cites government statistics which show that since 2000, death by suicide in Nova Scotia has risen to a record rate. He notes that over the last decade alone, suicide deaths per 100,000 population have increased from 12.2 in 2013 to 15.6 last year. Dr. Sherry says the self-inflicted deaths of 155 people in the province last year has met or exceeded crisis level. Well, joining us now is Dr. Sherry himself. Sir, welcome to Forum Daily.
Thank you.
So you're drawing attention to what you say is a crisis level of suicides in the province of Nova Scotia. Can you give us more insight into the data and the demographics behind all this?
Since 2000, Nova Scotia had a very fast rising rate of suicide. In fact, between 2000 and 2012, we had the fastest rising rate of suicide of any province in Canada. And since 2012, our suicide rate has remained stubbornly high. And over the last few years, it's grown even higher still. With the exception of the 2020 COVID year, our numbers keep going up and up, even after you adjust for population growth in our province. As with other regions in Canada, this death by suicide problem is disproportionately affecting men. And over the past 12 months, it seems to have focused especially on men in the 45 to roughly 60-year-old age group.
So what is behind this concerning rise in self-inflicted death in Nova Scotia in particular, Doctor?
It's been difficult to nail down a cause for suicide in general, let alone a cause for our province in particular. But I can tell you a key factor behind these rising rates is that we do not have a government-led coordinated suicide prevention strategy. In order to reduce suicide, we need not know its cause. So if we engaged in a public health effort that actively tried to reduce death by suicide, we would be able to do so. But currently, we lack the political will to follow through and save the lives of some of our more vulnerable Nova Scotians.
And before we get into this strategy, sir, I wanted to touch on these demographics a little bit. You mentioned that men had the highest suicide rates according to last year's data. So why were men in their late 40s and 50s found to be particularly vulnerable?
This is speculative, but if you look across North America, for several years now, men in that demographic have been dying by suicide at a higher rate. These men are often struggling with employment. They're experiencing the breakdown of their family, and they often become involved heavily with alcohol or other drugs. These are sometimes called deaths of despair, and they seem to be disproportionately affecting white men in the age demographic mentioned.
All right, sir. So you're calling for a comprehensive prevention strategy to address this issue. What would this look like?
First of all, it has to be energized by timelines and funds that are real. Nova Scotia has a suicide prevention strategy, and it sits on the internet as a PDF document with no real money and no real deadlines impelling toward action. If we were to actually create a suicide prevention strategy in our province, at the core of it should be something called means reduction. And in a means reduction strategy, you take away the means by which people die by suicide. So if your citizens are jumping off a particular bridge, you put up a barrier. If your citizens are dying by suicide with a gun, you look toward gun control measures. If people are consistently overdosing, you start to think about less harmful medications dispensed in a different way. If people are disproportionately dying by hanging, you remove ligature points at which you can hang yourself from prisons, psychiatric wards, or other institutions. You take the means away by which people are dying by suicide. This is our leading and perhaps even only evidence-based strategy for preventing suicide.
It's clear prevention plays a huge role in this strategy, sir. A quick 30 seconds left here, but what role does the federal government play in helping this issue not only in Nova Scotia, but nationally?
Canada is embarrassingly behind on suicide prevention. And in part because of that, we have roughly 10 people who die by suicide every day. Compared to other wealthy developed countries, we lack a concrete, actionable, funded suicide prevention strategy. In fact, we're sorely behind other nations who have prioritized the prevention of suicide.
Clearly, a lot of work needing to be done. Dr. Sherry, thank you again for your time today.
I appreciate the opportunity to speak on this important issue.